We're not going to know for a long time, maybe ever, why some countries had the mortality that they did during the COVID-19 pandemic. But what we can know, and perhaps what we need to know even more, is why governments did what they did, why societies responded as they did, why you had tragedies such as denialism in Brazil and the United States, or failed shutdowns of the economy in India or South Africa, why you had successes in countries as distinctive and ill-matched as South Korea, the People's Republic of China, Norway, and Mongolia, all unusual and presenting a great puzzle for comparative politics. In February of 2020, we were prescient enough to start assuming that there needed to be a comparative project that would put some shape into what would inevitably be an emerging field of understanding what we had learned about politics, about the politics of health and public health from the pandemic. As the pandemic escalated and it became clear that it was going to teach us far more than any of us wanted to be taught, we expanded the list of authors until we now have 34 countries plus the European Union and the WHO, 67 authors from 5 continents, all brought together in a tightly comparable, theoretically driven book whose objective is to understand what health and public health measures governments took, what social policy measures governments took to enable people to stay home if they could, and why they did it, ranging from authoritarianism to democracy, from different political institutions, and issues such as the role of the populist radical right or federalism. We brought together a group of authors who exceeded our wildest dreams, countries, the well-known ones, the Chinas and the United Kingdoms and the Italys, but also countries whose stories are fascinating and much less reported. Tanzania, Malawi, Colombia, Austria, all of them furnished not just information about what happened with coronavirus as processed by real experts, but more importantly, what it teaches us about the routes we want to take as we understand what governments chose to do and why, what it teaches us about political regimes, political parties, political institutions, and the ways that they respond to a sudden and unexpected shock that endangers many people's lives, as well as political careers. Coronavirus Politics is an interdisciplinary book, as well as an international book, bringing together experts in political science, public health, clinical medicine, and a variety of other fields, because that is what is necessary to understand something as multidimensional as the politics of coronavirus response around the world. It's aimed, therefore, at everybody in public health who is more or less frustrated with the politics of their country's response, as well as political scientists who generally don't pay a lot of attention to public health and have now been presented with an extraordinary opportunity to learn and think about the impact of things like political institutions when hit by something so foreign to conventional politics as a global pandemic. There's going to be a tsunami of publications about coronavirus and what it taught us about the politics and societies of the world. And our ambition was to get in there first and establish the basic conversation as much as we can do to influence what kinds of lessons and what kinds of avenues of research people choose to explore.